Welcome, Dr. Roger. To kick things off, how do you usually introduce yourself when someone asks about what you do?
I would say a lot of times, well, typically I would introduce myself as a dentist, but one of the things I would also let them know would be that I'm also someone who looks at overall health in general. The mouth is the doorway to your body, and it's something that you also have to, as a health provider, look at. You don't just look at one thing because everything is interconnected. So I like to kind of look at it as a overall wellness person on top of a dentist.
Um, Tell us something that might surprise people that you have done that it's totally outside of your profession of dentistry.
I've done some movie production.
Wow.
And acting. I dabble also in entrepreneurship. Also, I do like to kind of think of other ideas outside of just medicine. But it overall, at the end of the day, it's always going to be for with the goal of helping people
Mm-hmm.
as a bottom line.
That is amazing. And this is a little bit more of like your hobby side more than just what you do, that your focus of what you do.
I would say it's more so whenever I can.
Okay,
Really.
got it. I love it. That it's a lot of different things that you would never expect dentist and the movie stuff. That's awesome. Okay, what inspired you into dentistry, and how did your journey end up in opening your own business?
So initially, dentistry has always kind of been in the horizon because I do have family that are dentists as well. When things were introduced to me, it always was this, hey, this is a great profession. You know, you get to help people, this and that, and then you'll also have your weekends, and you won't be on call like 24/7, things like that.
Yeah.
Come to realize it's not necessarily 100% the truth
Oh,
because these things like that always happen, but you still manage it to a point where you can actually still have some of your weekends and then trying to help your patients at the same time. My journey typically to opening my practice was I was out of school for about 2 years and where was working in a corporate office. And I just, not to say that corporate offices are bad, but that one just didn't really necessarily fit my style of practice. So went out, started to look at potential other options. That's when I met my good friend, to this day still mentor, Dr. Shively, and he kind of showed me and inspired me to pursue that in basically the lifestyle that he had, what he had accomplished, what he could have done being his own dentist with no one above him, telling him, hey, do this, do that. So that's kind of what really got me to think, okay, that's something that I can do. And at the end of the day, that basically turned into that. Ended up purchasing the practice, his practice, and it's been growing great for almost 7 years now.
congratulations! Amazing. I love it. What's more important, at least to me, for that a beautiful and healthy smile. Super important.
Absolutely.
Yeah. How has your vision for the practice evolved since you first opened?
And you first jump in, and this is for individuals who are just not necessarily well versed in the business side of things. It can become very, very overwhelming very quickly.
Okay.
And so when you first start, the idea is how do I keep that going without messing it up? But as you kind of realize that in our evolving world, things will continue to evolve, and it's not that it's getting any slower. If anything, it's picking up a lot more these days. That you have to stay on top of things, meaning technology, things like that. That's kind of how my vision for it became more developed. I really wanted to start pushing efficiency. I really wanted to start pushing digital. I really wanted to start pushing the effect of all of that, which would be how do you deliver things quicker with better quality, and how do you even make it more affordable for people.
Okay.
So that's kind of how my vision grew with what was initially to what it is now.
Absolutely, and that's how every business should be thinking because, like, your clients are going to start expecting that, and if you're not learning and changing with time, then they're gonna 100% go find another option.
Right. Exactly.
Yeah. So that's awesome to hear. How is your team's dynamic? What makes your culture unique?
I think our team is very aligned.
Hmm.
I think that is a good way of putting it. Everyone just works here because we know that this is the type of quality we're delivering to our patients, and we're all on board because of it. We do enjoy the lightness of the mood, so that's another thing too, and
Yeah.
and really just the type of patients that were already here. My goal was to just take that to the next level, and so therefore, how do we get more patients who are more so referring their friends and family as
Hmm.
opposed to just just driven by a quick Google search or whatnot. And I think that that's where a lot of the team dynamics is also created, is because if you have a lot of friends and a lot of families are coming through, your attitude with work is going to be a little bit different compared to
Exactly.
if you're pure strangers. So that's what I would say. The team dynamic and the culture of a clinic is different in that aspect.
Love it. And it's one of the most important things, especially in services, because even if you're not, yeah, you want to get a good service, of course, and you want to get what you want to get, but also is how the people that are doing it make you feel. Because you can go to a place where they do the job, but if they don't, the energy is not great, they don't treat you right, you're still going to try to find another place. So,
Exactly.
yeah, good, good. You seem, from what I've seen, from what I've investigated, to have a strong patient-centered focus. So, apart from the team culture, what other philosophy do you guys have to when it comes to building relationships with your clients?
I think that for me, just like everyone else as in the team, the philosophy basically just boils down to you how you want the outcome to be. So if you want a long term outcome, it's,
Mm-hmm.
it's that you have to nurture that relationship. You have to care about that relationship. You have to be very clear that this is not a just a one in one out. It's
Uh-huh.
something that's just gonna elaborate over time. It's like, again, with family, right? It's something that you don't. It's because it's a constant repeat. You get to see your family more than you get to see random people,
Right.
right? And that's kind of what happens, is because these people are going to become kind of like your family. You really
Mm-hmm.
want to stay on point with, hey, you're expected to see these people, and you're gonna want to go above and beyond. And
Yeah.
that's kind of where my philosophy lies. Is I think that in order for you to be able to build long-term relationships with these patients, then you have to behave with them the same as you would your own family.
Yeah.
And that's what I try to instill on our staff. That's what I try to
Mm-hmm.
instill on our newer hired and whatnot. But again, I've been blessed and fortunate to have some people who have been in part of this practice that are still, they've been working in the field for almost, call it 35, 40
Oh
years,
wow.
and they still want to continue with me too. So
Amazing.
it kind of goes both ways. We have some newer staff, we have some older staff,
Mm-hmm.
and I think that the philosophy, as long as you stay with it, will continue to work and build those relationships for you.
Right, and I think thinking not just on this client is just a number right now, like this money is coming in, but I want this client to be, uh, I want to be the dentistry for this client forever, and thinking more about that
Yes,
long term, also profit, of course, that relationship.
exactly, exactly.
Mhm. How do you approach training and mentoring for the new people that come into your office?
Um,
That's
that's a good question.
a good
So
one.
it's a good question because actually our office has call it. It's not necessarily your typical office. So a lot of the things that we do because of technology, we're actually able to deliver a lot of things same day, or if not, we try to shoot for very quickly compared
Okay.
to what your traditional path in dentistry would normally be. Because normally, call it like a dentistry, you should be able to deliver it in about a month and a half to, 4 to 6 appointments usually.
Okay.
We try to do it to shorten it up to about 1 to 2. So a lot of it involves us also learning a lot. And kind of for the new employees, it's a lot because when they're coming in, if they've never been exposed to it, a lot of times there's just going to be so much. And so just preparing them for it, really giving them and setting the expectations early is something that I would do very, very early on. Mentoring is obviously something that you always have to stay on top of. You really just got to allow people to make the mistakes, allow them to grow and evolve and want to buy into what we're doing. And so just to really just let them know, hey, you're not going to have any instruments thrown at you if something, doesn't, right? You just have to be open-minded and let them know, hey, you know what, mistakes are okay. You're fine. No one's hurt. Just make sure that you learn from your mistakes. Don't just assume, oh, it's over, and I'm just gonna not remember that. More so, keeping in touch with, staying grounded and actually learn, not just okay, it just happened this time. I won't worry about it next time.
Right, and that's the most important part, I think, of being a leader. It's helping, letting people make their mistakes. Because if not, then you're gonna just put all their words on your back. Like now, exactly. So
absolutely,
it's great. What dental services are you more passionate about, and why?
So when I first started early in my career, I would say just getting rid of cavities for people. That was the idea behind being a dentist, right? And I think that's a lot of times what people assume we do. But as I kind of grew into my career, I think what really, really kind of started to stand out was even in this field, a lot of things is misunderstood, misconstrued, and I want to say when you're able to transform the thoughts, the ideas behind it. So, hey, you're not just going to the dentist because, you're having a cavity. You're actually going to the dentist because now other things are starting to affect you that starts because of the mouth. So, like, for example, patients who are grinding who can't understand why it's happening, or two, where the muscles are so tense, it's causing them to have headaches all the time. And it's physically now affecting them, just not in the mouth, and not just because, there's a cavity there. Now there's more of your PMJ issues. There's also the gut health, right? Starts with the bacteria that are in your mouth. You control that, you can control basically whatever else kind of passes on, and therefore you can also start to limit, um, you know, gastric refluxes, stomach ulcers, issues like that. So those are all other things that I'm now actually realizing that dentistry actually accomplishes for people. So that's really where I feel like dentistry is now making an impact on people, is all of that. And that's what I mean earlier. Everything is interconnected. So you really want to have everything just kind of dialed in together. And your understanding has to go beyond just, oh, there's a cavity, this is a tooth, you have to put a filling in, crown, whatever.
Yeah, like that's where it's that thought of like treating more than just a symptom. It's like going a little bit beyond.
Deeper.
Yeah.
Exactly.
This is a good one. I've heard a lot. There's people that are very anxious about going to the dentist. How do you handle, if you've ever had clients like that? How do you handle those people?
So there's many ways these days to handle that. One, if they're extremely, extremely fearful, and if it's kind of beyond what you can just do within the office, sedation is a great way. You can just kind of like how you're getting a surgery now. You can just basically get an IV in your arm and just go to sleep.
Oh wow.
So that's one way. Another way would be to slowly start them on something a little bit lighter. So a pill that you can take. Probably it's like a Xanax, a Halcyon, or something like that, and they'll just kind of calm them enough that they can kind of tolerate being in the chair. And when they've had enough of, I call them wins in my chair. So basically, they came in, they didn't, have any gagging reflexes, they didn't have any panic attacks or anything like that. Those would be considered win. The more win you can basically put in your core, the more they'll realize, oh, okay, you know what, this is not such a bad thing going to the dentist. And so the end goal would be to essentially be able to wean them completely off of those pills every single time they come in. And at that point, then you really got a major, major win in my book. And that's when you're able to just be able to have them come in and just talk them through the procedure instead of having to medicate them.
Right.
That would be how I would handle it. A lot of times I usually always start with just the talking first, but if they kind of realize that, hey, this is too much for me, I need that pill, so then we'll start with that.
Okay.
And then if it evolves beyond that, usually I haven't had any patients that I've had to really just stick an IV through, but
Nice. That's
there's
good.
some out there. So not to say that it's not possible.
Hmm. Okay. Well, thankfully you haven't had to deal a lot with that.
Yeah, it's been luckily
Yes.
been good.
Exactly. Okay. Now talking a little bit about technology. As I'm sure you might know, it's transforming healthcare. Have you integrated any tech in your business to help you with anything?
Oh, absolutely.
Okay.
That's basically how my office runs now. It's all pure tech.
Hmm.
From impressions, which are done now with a digital scanner, to our mills, which produces our crowns and bridges, our 3D printers, our facial scanners,
Hmm. Hmm.
um, digital X-rays. AI is integrated in my practice too,
Oh, nice.
helping read X-rays and things like that, so make sure that we don't actually miss anything. Yeah, no, it's what runs my practice every day now.
And you would say it's a no-brainer.
Absolutely.
Yeah.
If you're not, honestly, in my opinion, if you're not utilizing it, you're definitely starting to fall behind.
Good. Um, have you
Like
seen?
way,
Wait, like totally.
oh yeah.
Have you seen any trends in patients, like concerns or preferences that have come in the last years?
Well, trends, I want to say probably the cosmetic thing is starting to become a much more,
Mm-hmm.
call it forefront now,
Yeah.
because a lot more people are kind of coming out saying, hey, I've got my teeth done, versus before where everyone do get it done but always kind of trying to hide it, right?
Mm-hmm.
Those would be one trend. Another trend would be how now anything that used to be preventative, so like fluoride, big topic, is now kind of being given a bad stigma, and even to a point where now certain states are now trying to ban it. Um, those would be kind of trends and concerns. So I think a lot of people are becoming more informed, but one of the things that comes with more information also uh, should include how to properly vet the information.
Yes.
And I think that a lot of people don't have that particular skill, and just believe whatever is being said is not necessarily the best way of going about it.
Correct, because sometimes like clients now are getting to the medical practice way more informed, which is good, but also
Mm-hmm.
they should always listen to the expert because
It definitely has.
yeah. What's one piece of advice that you wish more patients followed between visits?
Floss.
Floss. I thought that was gonna be it. People don't floss enough.
Yeah, I'd probably say that's the biggest piece out there. I mean, people want to do good. I get it.
Mhm.
Everyone's busy. We all have lives. We all have things to do outside of just your doctor visits and things like that. And it's normal, right? Kind of like how in the morning, right? People, when there's two types of people. There's the one that gets up, make their bed right away, or there's the
Mhm.
ones that just get up and just walk away.
Mhm.
It's like the same thing. You kind of have to make that decision yourself. And at the end of the day, if you really want to truly take care of your health and not have cavities in the future, then that probably was one of the biggest ones, especially for, I think, adults have the hardest time doing that. Whereas
Mhm.
now, I think the next generation of kids now floss a lot more, because the parents who had a lot of issues were always on them about it, which is a good thing. So just depends.
Yeah. Okay, now we're going to switch it a little bit more to the business growth side and marketing side of your business. So,
Mm-hmm.
as a business owner, what's been one of your biggest challenges in growing your practice?
The biggest challenges were probably how to integrate all that technology and make it a part of a fluent system. Because for us, the word of mouth has been so strong.
Mm-hmm.
never really ever had that many problems with getting new patients,
Nice.
which again, blessed to have
Uh-huh.
not to have that issue.
Yeah, totally.
Um, but in terms of growing the clinic too, is also adding that technology requires space, and sometimes dental offices are a little bit limited on that, and that's kind of maybe
Got it.
my thing when it comes to it. But I think something that helps with the growth of is also just using that technology as your piece of advertisement. Like, this is what we have here.
Mm-hmm.
This is how we treat our patients. This, so all of that kind of goes along with it, helps grow. In my mind, that's how my practice helped grow.
Mm-hmm.
It
I,
helped
I
practice
can
grow.
imagine. I'm not sure if this is right, but not only maybe the space, but also the with the equipment that you have. There's if you have it busy for this amount of clients, then like you have to wait till that is done to get other clients. Or wouldn't it work like that? Like for example, an exam takes a week to develop something like that, and you would just have to wait till that's done to get more exams done. Or that doesn't apply with your tech.
With you're talking about X-rays.
Yeah, like X-rays, for example.
Well, X-rays used to take, call it like 30 minutes to go from when they were taken to being able to see them.
Mm-hmm.
With technology now, it's literally instant. It's like click a button. It's like a photo. You take a photo and then it pops up
Got
on
it.
your screen.
Got it.
So now that's not really the issue. I think the issue is just so more so because it's a lot of tech. Tech is more, call it an investment.
Mm-hmm.
It does require a little bit more funding to be able to have those. I call them toys, but
Yes, the
basically
toys.
there's a lot of toys, and we try to make use of it.
Right.
And so sometimes there's the ones that you'll use every day. There's sometimes the ones that you'll use like once a week, once a month, you know. And so it really just all depends on, call it. I mean, because it's a business, you have to look at the profitability of it, and
Yeah.
you have to look at whether or not it makes sense.
Yeah.
I mean, did I buy equipments that were basically like jackpot? Yes. Did I buy stinkers? Yes, I have to. So it's like you really never know until you kind of are utilizing it,
Yeah.
and that's kind of how you figure it out along the way.
Got it. Understood. Apart from, because you already mentioned you were very successful in word of mouth, that's great. Apart from that, what other channels do you use to find clients, or is that just the only one?
Uh, Google. I think having a Google presence is always
Mm-hmm.
great. Written reviews.
Okay, like
Those
a
are
Google
always,
business, like a Google business profile,
yeah,
right? Okay.
yeah, and good reviews are always key too. I think these days it's much more important to have those than ever
Mm-hmm.
because a lot of, and not to say that word of mouth is the only way we get patients, but the other ways you can get them is through either organic or paid search. Those are the two ways. And I feel, again, very lucky that a lot of our organic traffic is really strong
Mm-hmm.
because we have a good team that's taking care of our websites and things like that. And they give me a report once a month that I get to see, and I can see where traffic is basically coming from: social media, Facebook, all that stuff, or Google. And I can say that Google has been a very big
Mm-hmm.
referral tool at this point.
Amazing. And is that a team that you have in your office, or is that like something that you refer?
No, they're remote. That's
Cool.
it's a separate
Cool.
company.
And is this something like how did you? When was the moment that you decided, okay, I think I need, or this would be good for my business?
Uh, so I started. So the office always had a website,
Okay.
and when that website started to kind of look a little, I signed up with this other company when I met them at a trade show. And
Oh,
I mean, I've always was a big believer that calling card is your website, and especially for in health.
mm-hmm.
And when it came time, I had to revise it and build it back up. That first company that I utilized was kind of giving me what I wanted, but not really. So I decided to switch again.
Okay.
And it's really with that second company that I'm with now. We built this synergistic relationship that really just they trust you to give them the ideas that you want, and vice versa. I trust them to execute on it.
Mhm.
And that in itself has been, it's open communication. I think a lot of office don't think about it that way. They just think, well, I need a website, so I'm just going to hire someone and I'm just going to let them run
Yes,
with it. But I
exactly.
really think at the end of the day, get what you put in it. And so working with them very closely,
Mhm.
I've had the opportunity to really just give them my vision for what I wanted and let them just kind of take it, and everyone just cooperate together and come up with a final product that is ultimately what it is now. But I'm very proud to say that that website is something that I know I've had something to do with it.
Yes.
And same thing, they've had to do with it. But like it's it's still evolving. Like, we still have meetings quarterly where we're just going to discuss, hey, what can we do better? How do we improve it, or things like that. And but I think that your website is your, even before your front desk, it's your first front facing, customer facing, patient facing calling card, really.
Absolutely. And yeah, what you mentioned is it's very important because that communication with the client and the whoever's helping, because every business it's not just the dentistry. Every dentistry has its own specifics, and so really
Mm-hmm.
focusing that strategy to what you exactly need or what you want to focus in, it's very important. It's not just create strategy that is, for example, just dentists near me. But what if you want to focus on a specific service that maybe is the most profitable for you? Then that communication and the person responding, or the team responding to that and focusing the strategy to that is what really is going to help both of you grow in the future.
Mm-hmm.
Amazing. So
Yeah.
apart from that, if you have like a magic wand and you could double the ideal patient that you want, what would you do?
Boy, if I had doubled them tomorrow, I'd need a bigger space.
Okay, okay, fair
Okay,
enough.
but um, so what type of patient would they? I think I would want the same type of patients I'm getting now,
Okay.
because they're the ones, at least personally for me, I think they're the ones that appreciate what I do for them. They're
Mm-hmm.
thankful. They're not bashful about anything. We're all humans. I mean, do you make mistakes? Yes, absolutely. We're all humans. We all do. Luckily for me, I can't say that anything's been fatal or anything like that. Which, but at the end of the day, too, I think one, they would be about the same type of patients that I currently have because of those reasons. And really, I mean, however they would hear about me, word of mouth, works that I've previously done, I've published in magazines and things. So if they've
Mm-hmm.
seen it there and they come to me, I'll be honored to take care of them. However way they would hear about me, really, at that point, it's just an important. I think personally for me is, as long as someone's trusting me with their health, is my reward.
Mm-hmm.
That they decided to come here personally for me, and where there could be tons of other options at this point in time.
All right, and the final question, more about like a pain point. Is there any struggles that you have had with any of the teams that you work with in regards of because I know that the dental space can be a little competitive in the digital space.
Mhm.
So is there any
Yeah.
struggles that you guys have had or that you guys keep having in regards to that?
In terms
Of like your digital marketing efforts.
the problem, so I would kind of put it this way, just kind of like how patients have a hard time finding a good doctor, a
Mm-hmm.
good dentist. It's kind of like the same for us. We don't really know who's a good mark. So
Yeah,
you
yeah,
know
totally.
that at the end for us, especially running a business, right? How do you know who to give your money to? And we're not talking small sums, right? It's not like $100, $200.
Yeah.
It's like in thousands, right?
Uh-huh.
So that's where it's like, okay, we try to be conscious of the spending,
Yeah.
but we also want to make sure that it's not going to waste, right? So it's not like, especially for smaller businesses, we don't have a crazy unlimited amount of budget for when it comes to marketing. So that's when we
Mm-hmm.
really, I think personally for me, that would be the biggest challenge, because I mean, I don't mind spending the marketing dollars. It's just more so how or who to trust with it, and how do you know? I can't tell you how many marketing emails I get in a day, whether it just be in my inbox or on LinkedIn or wherever. And
Wow.
how do you go through all of that? How do you vet all of that? How do you select one
Exactly.
out
Exactly.
of thousands, right?
Exactly.
So a lot of times that's basically where you have to decide one day, hey, I'm just gonna try this guy, just try that guy. But
And test,
at the
right?
end of the day, right? Exactly.
Yeah.
Test it, see how it works.
Exactly.
My pain point at that point,
Got it.
how to find we all want to work with the best. We just
of course.
don't know who. There's, I guess, I hope that kind of makes sense.
Yeah, this was a great conversation, Dr. Roger. I appreciate the time. I appreciate all of your knowledge and